This next segment that I'm going to cover are about nervous system, nervous health disorders. It's a main area of focus in first aid because pain and anxiety and stress and insomnia and all those nervous system problems are a major part of what you're going to be treating when working with people in first aid situations. So the first part of nervous system problems I'm going to start with is pain. Pain is the most common symptom that you are going to see as a first aid worker. Pain is the thing that brings people to see people to get adjusted. If they don't have pain, often they don't know they have a problem, especially if you can't see it. You're not bleeding or some obvious physical change. So really, pain is extremely important for herbalists to understand the categories of different kinds of pain, start to understand the individual personalities of the plants when it has to do, or the personalities that they treat when it comes to pain, and then other associated nervous system disorders. So I'm only talking about first aid here, so I'm not going to talk about long-term nervous system problems, but the kind of thing that you are going to see as a first aid herbalist. But I want to reiterate that it's really important to understand. You don't actually have to understand the patho or the physiological mechanisms of pain and how neurotransmitters work, because in reality is we're not really sure what herbs work as GABA agonists and what herbs work to increase serotonin in the cleft. It's interesting. I love studying the nervous system. Neurophysiology is fascinating. But actually, with the nervous system, it's less about understanding how the physiology works in our body in the nervous system and more understanding the complex pictures we see that people present with physical pain and emotional pain. So learn your categories, and we'll cover the categories and different herbs in them. So the overview of pain is the most common symptom, right? People come in because something hurts. It might be, I guess, as well as physical pain, the other way that people hurt will be emotional pain, generally stress, anxiety, fear, and then things like insomnia. So these are not things that you can measure by looking at them and putting up measuring lab tools. These are things that you assess by your patient telling you about them. Pain has an immediacy about it. It's important to hold your ground and to remain calm and focused when people come in, especially in a lot of pain. Pain drives people crazy. It makes them act loud or withdrawn, but it's a very strong sensation. And people will often draw you into their pain. Like when maybe some of you have had this, where you have a toothache and it really hurts. And in a sense, you want everybody to know how badly your toothache hurts. Like, I'm in so much pain. And even though people can see it, but nobody can feel your pain, right? I mean, they can sense that something's wrong with you. But your pain, so you have this immediacy associated with pain, and you might not be able to resolve the pain right away. And so you just have to do the things we'll talk about that practitioners can do to make the person feel more comfortable as you work within the pain. Some of the pain that we're going to see is beyond our controls. There's lots of pain. Herbs aren't going to be the most effective tool for them. Some of the things, by the way, that really help pain are plants, but they're so illegal that there's no way you're going to use opioids or opium in a first aid situation, though it does control pain. It has the nasty side effect of dependence. But so there are actually some of the plants that are used for pain, and really what I'm talking about, the opiates here, that are incredibly effective, but I don't use them at all. I don't play with them. There's no secret tincture of opium poppy heads in my first aid bag. It's a federal offense, and I'm just not going to work with it that way. So some of the pain that people have might need to be seen by more professional folks who have this arsenal of stronger medicines that they can legally give the person. In other words, a prescription. So there's an immediacy to pain. People put a lot of pressure on the practitioner, resolve my pain, resolve my pain. Other things people often more will wait a little bit for, not with pain. They want it helped right away. But there may be no quick resolution. Pain is a subjective experience. There is no pain tools to measure it. There's no hooking up electrodes to your body to see how it's firing. When people describe their pain, it's how they feel pain and how much pain they feel. So for you, the practitioner, you have to put it in the realms of who they are. Some people feel pain easier than other people. Basically, you can stomp on their foot all you want and they will just like maybe show a tiny grimace and go ow. And other people, you just rub up against them, like you just push against them, they're like, ow, that really hurt, right? Same human beings reacting to pain differently. So you're going to have to work within the person's subjective mind frame of what pain is for them. And you can ask them though, for you, how bad is this pain? And then you have to make your own assessments based on that. But there's no measurement. There's no outside lab tool that says this is a 10, this is a 4. It's subjective. So pain is a symptom and not a disease in general. There are some chronic pain disorders, but I'm not going to be talking about those. Those are nervous system disorders that are chronic. Pain is a symptom of something else. So pain might be a physical injury. Pain might be an internal injury. But pain is not the problem. Pain is a symptom of the problem. Why this is important for you to understand is because, in a sense, your goal is not to obliterate the pain, which feels great when you can do it, but your goal is to stop the thing creating the pain if you can. Now, sometimes it really is just stopping the pain. You hurt yourself, stop the pain, the person heals. But pain is an indicator that something is wrong. And so your goal as a practitioner is to try to figure out what it is that's wrong, that's creating pain, because rather than just obliviating the pain, is to stop the thing that's creating the pain. I'm going to discuss some of the things, some of the diagnostics, and some of the differential diagnostics to get there. So your goal is to find the source of the pain when possible. Sometimes it's obvious. I mean, somebody hurts their arm or something and it's not particularly damaged, and you just stop the pain and they'll repair. So it's not, you don't always have to find the source, but it is helpful for a lot of different kinds of pain. So pain is an important clue to where the damage has occurred. It also, by the way, means that sometimes you don't want to knock people out right away in pain, because then you can't find out what's wrong with them. So if you put on very numb, if they hurt a part of their body and they become numb, but you still have to fix the part of the body, they're not going to react as much when you palpate their body and try to find the point of the pain. Now, in general, if you hit the point of anybody's pain, they do react. So, but the point here is that, just stopping the pain before you can figure out what's wrong is not always what you want to do. The person, though, will probably want that. They just want the pain gone. Pain encompasses both mental or emotional or psychological pain and physical pain. This is very important to distinguish sometimes. They, of course, interbreed, right? Emotional pain will heighten physical pain. Physical pain can heighten emotional pain. So there's no perfect word for this mental, emotional, psychological pain. One word to call it is trauma, right? Most first aid circumstances have a part of this emotional, psychological pain. The person falls and, so your day is good and you're walking around, everything's fine. All of a sudden, you trip in a hole, you twist your leg and it hurts a lot and you're all like, arr, and you're angry and you have all this other stuff. That's a part of the pain complex, right? So it's not like the physical pain, like a shooting or lacinating pain, but that trauma mode, that emotional aspect, you often want to consider as well, because they feed each other. So reducing one often reduces the other. So the different herbs often work more on a physical level or an emotional level. So when we talk about plants, we'll talk about herbs like anemone, which are very much in the emotional realm. And then you have plants like Jamaican dogwood, which is more about helping physical pain. But once again, they feed into each other. How you approach the patients in pain is more important than other places where our bedside manner and counseling matter. People feel pain. Like when people have pain, they feel it. It's a real living presence in their body, in their psyche. And if you meet them there, it often feels better for people. So the style that you present, people need different styles. Some people are more like, need a lot more compassion. Some people a little more tough love. It's really just about the individual and meeting their style. But you as a practitioner, how you address people with their pain can help within itself. As practitioners, how we address people is always important. But in my experience, addressing pain becomes even more primary because the person's uptight and has this whole immediacy to it. So just saying something like, somebody comes in, let's say they have a really bad toothache, and they're also really distressed because now their head feels like it's exploding and their mouth, and there's all this pain. They can't sleep, they can't eat, they can't think. They're having an incredibly unpleasant experience. And so just simply saying something like, I see that you're in a lot of pain and I want to help you, and I'm going to do everything I can to reduce your pain. So it's not going to stop their pain, but there's a sense of compassion and a sense of like willingness to work with them that could be helpful in this experience. Pain, in my mind, is a continuum with, well, really nervous system remedies. So I'm just using pain as kind of an overarching theme here. But the bigger theme is nervous system remedies. And when I think of reducing pain, and also for the emotional parts of it, I have it on a continuum that's nervines, sedatives, and hypnotics. Nervines are plants that nourish the nervous system. Sedatives are plants that reduce anxiety or tension. They allay excitement. They reduce. Hypnotics are plants that help people sleep. Many plants fall within a realm. Some plants fall within all categories, and it's really just a matter of how much quantity and frequency of dosage. So quantity and frequency of dosage can say whether it's going to just nourish you and not really affect how you feel at the moment, or help put you to sleep. But often many plants kind of fall one realm or the other. So for me, valerian tends to be a little bit more on the sedative hypnotic realm. It can be used to nourish you, but I find it primarily good for reducing excitement, reducing real strong pain, and helping people sleep. A plant like passion flower, Passiflora incarnata, I find it on the other side. I find passion flower better sometimes at helping sedate people, but even more so about helping nourish people's nervous systems. So I'm going to cover a bunch of herbs and talk about how I see them fit into this. But in my mind, plants are nervines, sedatives, and hypnotics. Nourish the nervous system, allay, reduce excitement, excitability, negative excitability in this instance, and help people sleep, and how you can use herbs in frequency, how often you give it to them, and quantity per time. So that's the nervous system continuum. That will also be talked about not just with pain, of course, but with mental health, about anxiety and stress. We'll talk some about that too. One of the considerations with pain is it a chronic pain or an acute pain? In first aid, we're really dealing with acute symptoms, but this is where it matters. So if it's an acute pain, and what I mean here is that they don't normally have this pain. And your goal is to reduce whatever's causing the pain and just stopping the pain. If somebody has chronic pain, they have some digestive disorder that causes pain, or they have chronic headaches that cause them pain. If they have a chronic problem with pain, you want to ask the patient some specific questions. So acute pain, your goal is to find out what causes it and then stop the pain. With chronic pain, you want to ask a few other questions. So if they've had this pain before, if the patient has had this pain before, some of the things to consider is what has caused this pain in the past. Are they currently taking any pain medicines? Right? Are they taking any opiates, or opioids? Are they taking any pain medicines? And if they are taking pain medicines, are they currently taking pain medicines? Have they forgotten their pain medicines? Can they now not afford their pain medicines? Are they addicted to their pain medicines and trying to withdraw from the addiction to their pain medicines? So now we're talking about the people, if they're taking drugs for their pain, you want to find out what categories the drugs are in, because you might be able to use similar categories in herbal medicine. And you also want to find out if the pain medicines they're taking, if they're really strong, if the person's taking a combination of opioids, like oxycodone, and steroids to reduce some physical pain, that's going to be pretty hard to copy with herbs. On the other hand, if they're taking really small amounts of different pain medicines, like analgesics, things like Tylenol or your NSAIDs, your non-steroidal anti-inflammatory drugs, and they want to try some herbs, you have a better chance of working with it. It also partly depends on how much of the pain medicine they're taking per time, right? If they're taking a lot of, they're taking 4 aspirins or 4 Advils or something, that's also meaning that they need more to reduce the quality or the quantity of their pain. So if the person's taking pain medicines, find out what pain medicines, what's caused this problem previously, and then work from that. If the person has never had this pain before, Some questions might be, do you have any idea what's causing it now? I mean, if you come in with a twisted ankle, I mean, it's pretty obvious. But other times people come in and say, you know, all of a sudden my arm really hurts and I don't know why. But so any ideas why that is? Did you sleep on it funny? Did you fall on it? Were you playing some game that it might have hurt it? So where does it come by? You might also say, does anybody else around you have this same pain? If they're in a group of people and everybody has back pain, you just question, maybe they're playing, you know, they're playing humid pyramid. You know, who knows what they're doing? But you might as well ask. If a lot, you know, does anybody else have this pain around them? And another question to ask, especially for acute pain, they haven't had it before, is did this pain come on suddenly or has it been slowly getting worse? In general, when things are sudden, you can knock them back down suddenly. When things are slowly getting worse, often you have to work them back down. So that's a huge generalization, but I'm going to say it again because it matters a lot in first aid. If something's just happened suddenly, they've never had a headache, and now they got a screaming bad headache, you just have to stop the headache. If somebody has had really slowly building headaches and it's been getting worse and worse for years, let's say, and their headaches are getting worse, probably you're not going to find a medicine that's just going to stop their headaches. You're going to have to find something that slowly backs down this headache that's been building up. You know, not the same headaches. Like, so it hasn't been, 3 years of getting the same headache, but they'd be getting headaches and it's worse now, then the next time it's worse. And so that's going to become a chronic problem. They're probably going to have to slowly back down. You might also want to find out if the person has chronic pain, do they self-medicate, and what do they self-medicate with? So they might just use pharmaceutical drugs, but they might buy them at a street level. So they might just buy their drugs on the street, which usually costs a lot more. So that would be a form of self-medication. They might use what are sometimes considered recreational drugs, things like cannabis, marijuana. They might use alcohol to self-medicate, as many people do. Or they might use heroin or one of the opiums, instead of opioids, one of the opiate derivatives or one of the opiates. So I would just find out, do they use recreational or street drugs? Do they self-medicate? In other words, not just going to a doctor and getting a prescription, do they take it into their own hands and how do they work it? And what can you do if they do? What herbs might you have on hand? Another thing to consider besides acute and chronic is the pain from internal or external sources? Like external sources just could be a lot of noise, or they're barefoot and walking on rocky volcanic soils. That would really hurt, by the way. They have little spines in them because they sat on a cactus. But it could be internally derived pains too, like headaches. Some headaches are external derived, right? A lack of food might create a headache, or a lack of water, or excessive water. It's not too common, really. But then you also have internal problems, like who knows why you have these pains. Like your arms just hurt and they look at, you get x-rayed and CAT scanned and nothing shows up in these. And so, that might be an internal. You might have a digestive problem and your pain comes from that. Not so much from food that you eat, which is more, you can control that external source, but internal. So is the pain externally derived or is the pain internally derived? That's another consideration. I would also say, is the pain more windy or more stagnant? A windy pain means that it keeps moving. It comes and goes. It has remissions. It has flare-ups. It can actually just show up in different places. Their knees hurt. Their ankles hurt. Now your elbows hurt. Kind of like a Simon Says kind of pain. And other people's pain is more stagnant. It's kind of in their knee, in that part of the knee, over and over, and it just stays there. So you also consider windy and stagnant. With windy pains, often you try to use herbs that are a little grounding to reduce the pain and kind of localize it and work with it. With stagnant pain, you often use deobstruents and things that help break up blockages, just on a general scale for pain. Really what I'm saying here is there's a number of ways to address pain, and you want to come from as many angles as possible to work towards it, so not specific remedies yet. If the pain is in their body, so if they say, I feel pain, if somebody says, my stomach hurts, so I'm working with somebody and say, my stomach hurts, one of the things to do is have them point. Because some people will say, my stomach hurts, and they'll go, point to where it hurts, and they'll go, right over here. And I'm thinking, oh, they might have swollen lymph glands or something. Your stomach is not down here. Now, of course, if you know about the nervous system, there's referred pain. Like you can have gallbladder pain rating up to your right shoulder. So forgetting referred pain, initially when people say, especially digestive problems, when they say my stomach hurts, have them point. The stomach is up here, right? But you could have pain other places associated with it. So the first thing is point to it. By the way, ask them to stand when they point, because if they're sitting down, and I'm going to sit down here for a minute, and they point, it's all kind of scrunched, like your digestive system fits this area. As you stand, you will see my digestive system elongate. So point to it to try to figure out where it is. And then, when people point, there's two manners they can point. If a pain is very localized, they will often use a finger and point it at a specific location. They might say my pain is here. If they say my pain is here and use 2 fingers to point to it, probably that's where their pain is, right there. But they might say my pain is here. That's a very diffusive situation. Sometimes you can say, can you point to it more specifically? And they say no. So you're kind of looking at, is the pain really localized? Often a muscle pain is. Like this hurts right here. It's torqued right here at the curvature of the large intestine, for instance, and that can cause a cramp. Or right here, and then you have less idea of what it is. But it gives you a sense of, is it a diffusive pain spread out? Often the person will wave to the area. So the same with headaches. So where's your headache? Some people say, oh, it's right over here, right? So it's a frontal lobe headache. And some people say it's right here, like a vice-like headache. And some people, just say, oh, my whole head hurts. So these are just different ways of considering pain. So moving towards the treatment realm for working with pain, there's a lot of ways to address pain. And partly how you address pain, how you address your patient is important. So some of your treatment questions, some of these are in your mind, and some of them you ask. Are you looking for herbs that work more in emotional, psychological pain, like it's just tight and tense in there, but physically it's not as much, like a specific part of the outside of the brain, really? Try to define which category of pain reducers, what kind of pain. Is it spastic pain? Is it cramping pain? Well, spastic and cramping are actually words that coincide with each other. Is it skeletal muscle pain? And soon I'm going to cover a bunch of categories for pain. And so those are some of it. I guess what I want to say with treatment is that pain medicines, all these herbs I'm about to talk about in a bit, are highly idiosyncratic in their responses. Idiosyncratic means individual. They're almost interchangeable words, idiosyncratic and individual. So my experience is that people react incredibly widely different from the different pain medicines. And what that means is that you're going to have to try different pain medicines with them. So I've talked about the 1-drop dosage. Apply it here. This is one of the easiest places, especially with a lot of pain. It's a heightened state. And 1 drop for many people of a pain reducer they will feel a little less. And remember, the sign of feeling a little less pain is generally a sigh and a relaxation. So you give them 1 drop and they go, and then they're a little bit more relaxed, or you feel a little less shoulder tension or their face a little less tension. That often means that you're at least in the beginning track of finding the right medicine. So highly individual reactions, try 1-drop dosage. And something that easily forgotten, I forget this way too much, is that when somebody comes to you in pain, ask them, have they tried herbal medicines before, and has it worked? Because sometimes they'll say, actually, chamomile tea works great for me for this pain. So instead of spending a half hour with all these questions, the person comes in and they just tell you, actually, you have chamomile tea there, or you have chamomile tincture. Chamomile works great in tincture form too. And then they say, this works for me. And then you say, would you like some? And then they say, yes, please, if they're polite. And then you brew up some tea for them. So don't forget to ask people if they've had this before and what's helped in the past. It really saves a lot of time. I'm saying it because sometimes I just feel like an incredible doofus when I forget this. And I'm suggesting all these things, and the person goes, actually, all I just need is some chamomile tea. So I hope that makes sense. So next are some of the preparations to use for pain. So there's both internal and external preparations that are helpful for pain. The internal preparations are all the common ones that you would probably expect. Tinctures, glycerites, teas, anything that you take internally are helpful for internal preparations. And then, though, don't forget that external preparations are often very helpful also for pain problems. And they comprise like compresses, when you make a tea and you put a rag and take that rag from the tea and put it on. Poultices, when you take a plant and chew it up or scrunch it up in hot water and put that directly on, like ginger. Soaks, making a really strong tea and soaking a body part in it. Things like hot water bottles applied topically can be very helpful. So you have a number of ways, and another form of external internal medicine are inhalations. Sometimes smells relax people a lot. So you might have a couple of essential oils or just nice smelling plants, maybe something like white sage plant, and just have the person crush a leaf and smell them. For some people, smells reduce tension, and reducing tension reduces pain. So you have inhalations as well. You also have essential oils that are sometimes used topically to reduce pain, sometimes as anti-inflammatories or as analgesics, direct pain reducers. So there's a couple of ways of reducing pain. So internally and then externally. One more external are oils. Could be very helpful for injuries. So your St. John's wort oils and your arnica oils, those kinds of external oil applications. So now we've talked about what preparation. If it's internal, start with a drop initially and just see how the person reacts. If there's no change at all, you just have to make a call, but at least it's not making them worse. So the early stages of treatment, so trying one drop. You also might want to help the patient, give them some suggestions for other things that are not herb related necessarily to help with pain. One of the things that can help with pain for some people are deep breathing exercises or just taking a deep breath. Sometimes also if people learn how to manipulate their body, do different stretching exercises, that can reduce pain, especially physical pains, where you look at them and they see torqued a certain way or held, you can see if they can loosen up. You can't always do it. Sometimes moving makes the pain worse. That's why they're in that cramp position. But working with just physical body postures can also be helpful. And then also just counseling about pain with people, talking to them about their pain can be helpful as well. Once you're in the course of treating them, then your pain medicines become important. So what I'm talking about here are the treatment stages. Your pre-treatment or early treatment, your peri-treatment or at the point of the symptoms there and you're trying to resolve it a little bit. And then post-treatment. So during your peri-treatment or as it's happening is your medicines. I would suggest with pain, trying to reduce the symptoms of pain sooner rather than later. As it's happening, once it reaches a certain crescendo, it can be really hard to reduce it. So if you could stop it in the earlier stages, like many health issues, it can be very helpful. And then post-pain, so in other words, you've helped their pain, now what? For some people, giving them medicines to take regularly will help reduce their pain as well. So for some people, if they have a certain kind of chronic pain, there might be plants that they take on a regular basis. This is very common, so that they don't reach these crescendos, these heightened exacerbations of pain. So consider tonic herbs for their pain. And then continuation of all the other strategies, body postures, breathing exercises, relaxation techniques, and all those things. I want to talk a little bit about herbs and legalities, and then we'll go to categories. I don't use illegal herbs. It's not whom I am. So no opiates in specific. Opiates, heroin, morphine, derivatives, they're illegal in every state, and they're federal offenses with carry large fines and more than fines that carry imprisonment. For you, by the way, and potentially your patient, which doesn't help pain at all. So the one I want to address a little bit right now is cannabis or marijuana. To me, marijuana is tricky. These days, I find that as it's becoming legal in states, so first, let me be incredibly clear, and I am all for the legalization of marijuana. Marijuana laws are just plain out stupid, right? So telling people what they do and can't do within things that are reasonable is just crazy laws. There's nothing to do with legality, but it is illegal. I live in New York State, and the laws are somewhere in the middle, but it's definitely not decriminalized or in any way illegal in New York State for medical uses or not. So first is legality. If you recommend cannabis to people, marijuana, I'm just going to say cannabis here, to folks, just be aware that if they don't in certain states, it's just illegal. And so if they carry it with them outside, they could be busted, which once again doesn't help your pain problems, emotional or physical. The other is I don't want to become over-reliant. Even in states where marijuana, like California, which is easily accessible, I find that marijuana is a pretty strong medicine. So I'm for its legality. If people want to get stoned, they're welcome to get stoned, as long as they're not my students in class acting stupid and stoned. So within those parameters, but also I just want to suggest that marijuana is a strong plant. And my goal is rather moving people towards chamomile and things that really don't alter their mind state rather than stronger plants. Now, everybody's different. There's lots of forms of marijuana. All of you marijuana advocates are going to start sending me hate mail. I will give your hate mail to one of my most stoned students who will then read the hate mail and go, what? So it won't really help, right? So I want to say, I mean, it's easy for me to, by the way, even though I have long hair, I'm not a marijuana smoker. So if you're thinking this, it's not a personal way either way. I'm for the legality. It's not a plant that I use. Probably if I was in a state that it was legal and I could give it to patients, I probably would definitely give it to certain patients. No doubt that cannabis helps people with some problems. Physical problems, they're not looking to just get high. And there's nothing wrong with getting high. I'm not an anti-getting high person. But I'm talking about as first aid work. I just don't want to, as it becomes decriminalized and used more and more, I don't want it to become the plant that we overly rely on because there are many other plants as well that we can use. All right, so, but remember though, you can also get busted depending what state you're in. So other drugs that you can use include aspirins and other analgesic drugs like ibuprofen, acetaminophen. So you have also another class of drugs. And I'm suggesting people carry them with them because many people prefer them and know them. And so I like to use herbs that I gather. I like to use plants. It's my tendency to use those. But I am saying that a lot of people will come in and they know that aspirin works. And they know that 2 aspirins work. They know they don't have any great problem with aspirin. And so it's handy to have those particular pain-reducing drugs on you. So basically, your classic over-the-counter, your Tylenols, your Advils, and aspirins. What I want to cover now is the general categories of pain relievers. And so once again, I find it very important to understand the categories of pain relief and not just specific herbs. I'm not going to go into depth with any of these specific plants. So there are things that you can study elsewhere or study with other herbalists. But it's really helpful to know some of the general categories and then some of the plants that fit into those categories. So I'm just going to go through them one by one here. The first is just general pain remedies. And so general pain remedies includes pretty much all of these. So you have things like hops, Humulus lupulus, Jamaican dogwood, and even kind of quirky ones like lobelia. So general pain remedies, like anything that you might use for pain. Cannabis, ethanol, drinking alcohol. So pain remedies, these general pain remedies, work through a couple of mechanisms, and I'm not going to cover any right now. So there will be a list that will be on the site that you can look at that will show general pain remedies, but it just means anything that helps with all these pains, a very general region. So now to get more specific. So the first one is something that I haven't found anything that works really good. So unfortunately, but I just want to bring it up, and that's anesthetics. Anesthetics, sometimes called anodynes, it's a general term, but it means that things that decrease the sensation externally when you apply them. So a classic anesthetic would be heat, right? If you apply heat topically, sometimes it reduces the sensation of pain. The classic anesthetics that you can't buy without a prescription are your cocaine derivatives. You have lidocaine and, lidocaine's really the most well-known of them. So lidocaine, basically when you put it on, numbs the area where you have to shoot it on or you can just put it on topically. And I've never found any herbs. That's actually derived from a plant, the coca plant. But I've never found any plants to work that effectively as topical anesthetics. So that's really what I'm talking about here. Topical anesthetics you can put on. So there are some things you can do, but I'm still trying to figure out what legal herb I can use to just numb an area. That's the point here, is numbing. So hot and cold, we'll talk about hot and cold in a different segment, can help reduce pain topically. In specific, we'll cover this later, but if it's a bee sting or an ant bite, tobacco poultice helps. So that'll be covered later. So that's a topical anesthetic, but very specific for bee stings and bee bites and ant bites. Cayenne pepper sometimes works as a topical anesthetic. I know it's initially it creates more pain. So if you have a wound and you put cayenne, sometimes you get this whole burning sensation. But afterwards, sometimes the cayenne kind of deletes or depletes all the serotonin that's a part of the pain manufacturing process of the nervous system and can help. So that's another one to try, but be careful with cayenne. Also, if you touch your eyes afterwards, it hurts a lot. Clove essential oil is a good topical anesthetic, but mostly just in the gums for infections in your mouth. It doesn't always work, but sometimes that's useful for toothaches, basically. And alcohol poured into a wound sometimes is also a topical anesthetic. So just straight out drinking alcohol poured into a wound. Not too much, it's expensive. But I guess the point is, like, people have told me a lot of these things, and I haven't found anything that if I just put it on will work as nicely as lidocaine and its derivatives. So I'm still working. But the ones I've suggested, I'll say again, is heat and cold, cayenne pepper, tobacco for bee stings and bee bites and ant bites, clove essential oil, especially in the mouth, and then alcohol poured into wounds. All work somewhat. If you, by the way, have experience with any of these things, you can write me and tell me what you've seen work. But really, it's not so much going to be about theoretical. Lots of people talk to me about the theoretical stuff, which might work. I just haven't tried it yet. But I would want to know lots of experience so I can put it into practice. So that's the anesthetics. The rest of the categories I have more experience with. So if you're watching this thinking, oh man, I just paid for this, and all he's going to do is say, pour some alcohol on it. But I won't. We'll talk about more categories. So the next category I want to talk about are antispasmodics. Antispasmodics are herbs that reduce smooth muscle spasms. Smooth muscles are those muscles that are involuntary muscles. Often you might just think of them as your organs or tissues. So skeletal muscles, we'll talk about those are the things that you can voluntarily move. Smooth muscles are those muscles that are innervated, and innervated just means the nervous system tells them what to do involuntarily in general. So classic smooth muscles, the uterus, the gallbladder, your lungs. Parts of your lungs are skeletal muscles, parts of the lungs are made up of smooth muscles, and very importantly, your digestive tract. So these are smooth muscles, and all of them could be prone to spasms. What a spasm is uncoordinated muscle cramping. Often you will know spasms by how they look. So when people often have spasms, gallbladder spasms or digestive spasms or uterine spasms, right? So I'm talking about as cramps, is the person will often clench their body and hold it like this. The reason you're doing that is you're taking the tension off, right? You're reducing the surface area, or you're reducing the area of it. So when you cramp, you're just kind of shrinking it all down, and it just relaxes the cramps a little bit. So that's one way to know that the person has smooth muscle spasms. Another, by the way, smooth muscle spasm is passing kidney stones, right? As the stone passes the ureter, right, going from the kidneys to the bladder, those tubes, ureter, and then out the bladder is urethra. But as this stuff passes down, you get a lot of smooth muscle spasms there. So smooth muscles are often organs spasms. I would say the two, though, main that I see are easily menstrual spasms or menstrual cramps, killer cramps, and digestive cramps. There's a bunch of herbs that are really useful as antispasmodics. I've used a lot of them, so I feel real confident or just comfortable talking about them. The first I've covered as a materia medica, and that is silk tassel. So silk tassel is Garrya. And silk tassel, so to learn more about silk tassel, look at the section that that's in here about silk tassel. But silk tassel I find especially useful for gallbladder spasms and for menstrual cramps. Two more herbs that are specifically good for menstrual cramps are going to be black Haw Viburnum prunifolium and cramp bark Viburnum opulus. So they're closely related. So two more antispasmodics that I find especially useful for menstrual cramps is black Haw and its cousin cramp bark, and it's Viburnum prunifolium. and Viburnum opulus. Also useful as antispasmodics, put in there marijuana. For some people is an excellent antispasmodic. For some people, ethanol, alcohol, in small amounts could be a good, useful antispasmodic. And one of the herbs that is my favorite gut antispasmodic. So if somebody has a digestive problem, they ate something bad for them, and they have really bad gut spasms. Their GI tract hurts, their stomach hurts, their intestines hurt, and that's wild yam. So wild yam, the two species of wild yam that I use are Dioscorea villosa and Dioscorea quaternata. Those two are excellent. They're very closely related. Those two are, I mean, some people consider them the same species. They look a little different. That's my favorite digestive antispasmodic. So just to put it, I have for menstrual cramps, silk tassel, black haw, cramp bark. For gallbladder spasms, I tend to work more on for the silk tassel, but all of them are worth a try. They're all antispasmodics. And then for GI spasms, I like to use all of them are possible, plus really considering wild yam. So that's a group of antispasmodics. Don't forget, though, other plants can work that you just want to consider in all these things, something like valerian or skullcap. Valerian has some antispasmodic action. Valerian does other things, but it definitely can act as an antispasmodic really well, so can skullcap. So this next category of herbs I'm going to talk about are not widely considered pain relievers, but by what they do in the body, they actually can very much help reduce pain. And that group of herbs is anti-inflammatories. Anti-inflammatories, many years ago I took a class with Tassel Garrya, and she talked about the way to reduce pain is through anti-inflammatories. And I just took it to heart, and since then, maybe 10 or 15 years ago, I just really started thinking about how to use anti-inflammatories in a first aid situation to relieve the pressure that creates pain. Pressure in our body, as in meaning inflammation, is often one of the starting points for pain. In other words, when you have a gum infection, and then you get bacteria in there, and the bacteria start to proliferate in your gum, they create pressure in your gum. That pressure is the pain. If you can reduce that pressure, so you usually reduce it by trying to kill the organism multiplying, creating that inflammation being pressure here. So anti-inflammatories, when you have a swollen ankle, that inflammation itself is part of the pain. If you reduce the inflammation, you reduce the pain. Now, you don't want to just stop inflammation automatically every time, because inflammation is a part of the body's healing process. Inflammation is important. So, but generally, the herb anti-inflammatories, as opposed to steroid drugs, which are very strong drugs to reduce inflammation, have positive and negative parts to them. But herbal anti-inflammatories don't tend to override all of the body's processes of inflammation, but might reduce it enough to just reduce some of the pain. So these plants work in a number of different ways to reduce inflammation. I'm going to read a number of these plants, and then any of the individual ones you can just look up. Some of them are more well known than others. So aloe vera has anti-inflammatory action. It's one of the ways, a few ways that it helps with burns. Arnica, which I covered in detail later, is one of the classic anti-inflammatories. You also have calendula. Chamomile. So chamomile is more distinct in helping gut inflammation. Chickweed, applied externally, Stellaria media, has anti-inflammatory action. Some of these things are demulcent, and the soothing demulcent quality of the plant somehow stops the body, reduces some inflammation. So I don't know the mechanisms, like whether they work on prostaglandins or some other aspect of the body creating inflammation. But you should know that you create the inflammation. Inflammation is not an outside event happening to you. It's your body's release of white blood cells, the cytokines, the prostaglandins. It's all the chemicals that you make to create inflammation are done internally. They're endogenous. The inflammation is your body doing something in response to something in general, real or perceived. So other anti-inflammatories, ginger. Ginger is really easy to come by. So one of the great things about ginger is that it's great It tastes good to many people. It's easy to come by. It works good externally and internally. You can make poultices and compresses and tinctures and teas from it. So ginger is really good. And a stronger anti-inflammatory is a close cousin of ginger, and that's turmeric. And I would say that turmeric is one of my favorite anti-inflammatories, both for inflammation due to injuries and internal inflammation, like inflammation of a GI tract with like an inflammatory bowel disease. So turmeric is a plant I use a lot. The only negative thing to turmeric for me, the positive thing about turmeric for me is that it's a good anti-inflammatory, has great placebo value. People have heard of it. It's really easy to find, but I have to buy it. So here in the Northeast, there's not a lot of turmeric fields. You have to go to probably southern Florida is probably the closest place you can find it, more likely Hawaii. So I really like turmeric as an anti-inflammatory externally, but it does dye everything yellow, right? Or orange yellow, whatever you want to call that color. So it's beautiful, but it will stain your clothing. It will temporarily stain the skin used externally. Internally, who knows what it does? I haven't never looked to see what people's esophaguses look like after taking turmeric. But I use a lot of turmeric in first aid. I use a lot of turmeric externally and internally for inflammation. So more than ginger, by the way. I think ginger is a better anti-nauseant and sometimes for digestive upsets, but I find turmeric a better all-around anti-inflammatory. It shows up in lots of my chronic patients with chronic healthcare problems and patients with acute inflammation as well. Another one of my favorite anti-inflammatories is Meadowsweet Filipendula ulmaria, and that, like chamomile. So chamomile and meadowsweet are great gut anti-inflammatories. I talked about wild yam being an antispasmodic for the gut. That's different. These are anti-inflammatories for the gut. So if your GI feels swollen, I would suggest meadowsweet and chamomile. The advantage to meadowsweet for me is it's naturalized as a weed here in upstate New York, so I can easily gather a lot of meadowsweet and use a lot of it. Also, meadowsweet tastes pretty good. It has methyl salicylates. That's the anti-inflammatory component. And methyl salicylate is the smell of wintergreen. So another really useful anti-inflammatory is licorice. So licorice I can go on for hours about. Licorice is another plant that covers a lot of bases. And while I have to buy it, it's $7 a pound for even good quality licorice. So it's easy to find, easy to use. Lots of people know it. Many people like it. It's sweet tasting. So licorice has a lot of advantages to it, but it's definitely a good anti-inflammatory. If there's inflammation internally or externally, consider making poultices or soaks or compresses of licorice, but even more than the external use, drinking licorice tea is a good anti-inflammatory for a wide variety of events, including things like toothaches. So I'm a huge fan of licorice. Poplar is an anti-inflammatory, and poplar's cousin is willow, and willow I went on pretty extensively about, and you can look at, but willow is also one of my favorite anti-inflammatories. The reason I keep saying my favorites is because there's many anti-inflammatories, and these are the ones that I'm covering. So I would say, to try to sort this out and condense it, in my first aid bag, the anti-inflammatories that I carry the most with are willow, and I would say willow covers the widest events of inflammation. Meadowsweet for gut inflammation. Turmeric for injury inflammation. And maybe those are the ones, and licorice for all around inflammation too, because licorice does other things. So I'd say licorice, meadowsweet, willow, and turmeric are probably my favorite anti-inflammatories. But you also have things, and arnica. So add arnica into the mix, very small amounts internally, used extensively externally. First aid has a lot of inflammation involved with it. So that's why I know so many of the anti-inflammatories, is because it's a big component in trying to reduce pain and help people get back up to what they can do. Another form of pain medicine are the inebriants. So inebriants are things that get you high, get you wasted, get you stoned, get you drunk. So the two main inebriants, they have to be controlled, but I want to talk about ethanol, alcohol. Alcohol, Jack Daniels, 95% ethanol, lots of wine, beer. Alcohol is a very good pain reducer. It doesn't have good secondary effects, i.e. a hangover. But for many people, if you have an acute painful event, like a toothache, And the toothache will pass if you give it time, and you are bloody crazy with pain. If you drink enough liquor, you will pass out. So you will wake up in worse condition in some ways, but actually the acute toothache pain might be gone. So what I want to say is, like, liquor, alcohol, ethanol have a lot of side effects. Many people are addicted. It could be a harsh, horrible drug, but not everybody has that effect from it. So I just want to say that if people are in a lot of pain and nothing's working, consider giving them shots of some strong whiskey or whatever it takes. Beer is not as good because you just have to drink so much beer and then you have to wake up and pee. So if they fall asleep. So what I would really suggest is just really considering it. Cannabis I've already talked about. For some people, though, it's a fantastic inebriant. So what inebriants do is they make you forget about your pain. In some ways, valerian can be an inebriant. So basically, you take enough of the medicine and you just like, who cares about my pain? By the way, that is dangerous if it's an injury, right? So somebody injures their ankle and it's really swollen and they're like, I'm just going to drink the pain away. And then they start walking on it. It's going to get worse and worse. They're going to have more pain and eventually they're going to have to do something. But I just want to be clear that one thing that often herbalists forget is a plant-based product, and it's called alcohol. It's widely available and it's legal for pretty much everybody over 21 as long as you're not drinking, and you shouldn't be drinking and driving anyway, right? To consider it. So marijuana and alcohol are classic inebriant pain relievers, and also large amounts of kava kava is a fantastic inebriant pain reducer as well. The next category are sedatives. So sedatives basically are calming agents, or they reduce excitability. So you use a sedative when the person is just tense and you really has a lot to do with tension. You just need to relax. Like, you need to calm down a little bit. So you're overly excitable, you're overly agitated, you're overly stressed out. Very common event in life, it seems. And it's certainly a common event in first aid circumstances. So if herbs to help reduce that. Now, first there's the inebriants, right? Just covered. I mean, in reasonable dosages, you can take alcohol or cannabis or some of those. But, you know, once again, I mean, I'm talking about them and maybe even in a joking manner, but there are major problems. With marijuana, it's just really strong, and there's the illegality. With alcohol, somebody can get drunk and hurt themselves more or do something stupid or drive. And also, it's just not the best way to reduce your pain all the time, in my mind. Better to have things that are not nearly as strong. So even though I'm joking about them, I want to be clear that I endorse them. I'm saying, I don't know if I endorse them. That's not the right word. I'm suggesting them because they do exist and they can help. But I rather use these other plants that don't affect people nearly as strongly if possible. So more sedatives. California poppy is a really nice one, really dose dependent. By California poppy, I mean Eschscholtzia species. There's lots of poppies, California poppies. By the way, they're entirely legal, and they don't have any opium in them. They don't have any of the opiates. So if you drug test, I don't think you drug test positive. I'm not sure if I've read this. I'm saying it as if it's true, but I've heard that California poppy doesn't show up on drug tests, which is helpful as opposed to poppy seeds, which can show up positive on a drug test. So California poppy, very good sedative. Dose dependent, by the way. California poppy can be a great nervine in small doses. Medium doses sedative, and large doses can sometimes help people sleep. And I really like it, the whole plant of California poppy. Epipactis is a good sedative. Many of you won't know that. Epipactis is sometimes called Helleborine. Helleborine. In the Northeast, it's our only non-native orchid. Non-native orchid is important because it means you can gather it. It's not specific. But Epipactis it's kind of a giggle plant. Like some of the groups of sedatives, people take them and kind of giggle their way out of their tension. And Epipactis, otherwise known as Helleborine, I don't know anybody who calls it Helleborine, but the genus of it is Epipactis, and the species of it is Helleborine. So it's Epipactis helleborine of the Orchidaceae, non-native orchid. It's the roots that are used, and that's another one that's a good sedative. Hops. Hops tincture is a really strong sedative as well. Hops is underused in my mind, except in beer. It's a pretty strong flavor, but just a really good sedative. So in order to get through all these, I'm just going to start reading some, and people can look them up as their interest grows. Kava Kava, Lobelia. Once again, I talked about lobelia as a materia medica. Lobelia just breaks up stagnation, and sometimes that overexcitability is kind of a stagnant problem. It just won't relax, and lobelia is helpful. Passion flower. I am a huge fan of Passiflora incarnata, passion flower, it's not the strongest sedative. It doesn't tend to make people thoroughly relax, but sometimes it breaks that cycle of stuck in your head. So I do carry passion flower in my first aid bag. For those who understand Ayurveda, for the Pitta types, passion flower can be a really great nervine tonic and also as a sedative. And then skullcap and valerian show up again as sedatives, as well as wild lettuce. So wild lettuce is more specific for pain, but sometimes wild lettuce will work as a sedative. And by wild lettuce, I mean Lactuca. All of these plants will have a cross-reference chart with them that are going to have their scientific and common names. So if you get lost in it, just rewind back to the plant I said, and then just go to the cross-reference chart, and I'll talk about the different species and genera that I use. The next one are skeletal muscle relaxants. So your skeletal muscles are your voluntary muscles, those muscles that you can move when you think about moving them, which is really pretty extraordinary. It's like, I'm going to move, I've already done that, right? I'm going to move my finger, but before you think it, apparently, you can do it. So skeletal muscles, and by skeletal muscle pain, generally it's people's backs. It can be their knees, but the most common skeletal muscle problems that I treat is the lower back primarily and the upper back. I talked a lot about it with black cohosh, Actea racemosa, formerly Simicifuga racemosa. So back pain, these are some of my favorite herbs in general. They are black cohosh, pedicularis. Pedicularis is also called lousewort, and some people refer to the pedicularis as betonies. I don't use betony because wood betony is an unrelated plant. It just gets confusing. So for me, I usually call it pedicularis or lousewort. But louseworts there's many species. My favorite is Pedicularis greenlandica. Is really useful as a skeletal muscle relaxant. I use it a lot. Black cohosh and pedicularis in specific. Also skullcap. And once again, those three together, skullcap, black cohosh, and pedicularis, I find a really good combo. Kava Kava is a really good skeletal muscle relaxant too. Marijuana, once again, a good skeletal muscle relaxant. And wild lettuce. Wild lettuce, once again, is showing up. It's kind of tweaking off at the edge here, but that's because wild lettuce is more of a pain reducer. And this, whether it's smooth muscle or skeletal muscle, just general pain remedy, wild lettuce is really useful. There'll be a handout associated with this course about how to make a really strong wild lettuce medicine, but I rely a lot on wild lettuce. It's just a straight-out pain reducer without affecting people's minds as much. Sometimes it does. That's why it's in the sedative category. But wild lettuce, Lactuca species of the Asteraceae, I find very useful for a wide variety of physical pain. So those are skeletal muscle relaxants. The next are sleep aids, commonly called hypnotics. So if you can't fall asleep or can't stay asleep, these are some herbs to use. As I said, my favorite is valerian. One of my second favorites is Kava Kava. But Kava Kava has an alcohol effect on many people. And by that I mean that when people first drink Kava Kava, which I'm just going to call Kava or Piper methisticum, when people first drink Kava, initially they get more excited. As they become a little inebriated and relaxed, initially there's a sense of excitement. So to take Kava to fall asleep, take it 2 hours or so. So drink some Kava, whatever amounts, a couple of dropperfuls, a couple of drops, whatever is useful for you. So small amounts to larger amounts. But take it a while, and you're going to find that often, initially you feel a little better and relaxed. And then later on, the more sedative aspect or the more hypnotic aspect will be a part of it. So Kava Kava is just a really helpful herb for a lot of pain and mental pain predicaments, and it's legal. Lobelia. So once again, lobelia just breaks up stagnation. So if insomnia, sometimes lobelia just relaxes people. It's really without getting into any specifics. And for some people, it is really helpful as a sleep aid. Hops. Sometimes large amounts of hops tincture. You could try to drink hops tea. It's fairly disgusting flavored. But hops can also be a great hypnotic. These are things that help people sleep. And California poppy. So California poppy, hops, lobelia, Kava Kava, and valerian are all helpful sleep aids, with valerian being my favorite, Kava Kava probably be my second, but only if taken beforehand. And California poppy and hops, it's really dose dependent. You just have to take enough to get sleepy from. So, this next category of herbs I want to talk about are trauma aids. I wasn't exactly sure what to call these herbs, but they tend to help people when they're in a trauma mode. And by trauma, usually a sudden occurrence or a sudden problem has happened, and then people kind of go into that place when things go wrong for them. Some people become very flighty and hard to make any decisions. Some people become very stuck and very angry and very controlling. And some people really draw back into themselves. So there's other things that can happen. Those, by the way, are often associated with Ayurvedic constitutions, with the more flighty person being more Vata body type, with the more angry, controlling person being a more associated with Pitta types, out of balance in all of these, and with the more pulling into themselves, the more depressive, can't do anything, lethargic is often a more Kaphic type. But the trauma aids all work differently. So I want to cover these plants that I find especially useful when people go into these situations and just get stuck there and have a hard time moving out in any of these directions that I've mentioned. So each one of these plants easily spend a long time, so I'm going to cover them quickly here. One or two of them I've covered in other circumstances, but you can just, to learn about them and to understand their specific uses in trauma could be very helpful. The first is calamus, Acorus calamus. And calamus is just very grounding. It's more for people who kind of fly outside their body when situations happen. They want to be present. Anemone we talked about in Materia Medica, anemone is more for panic attacks. Cannabis is tricky because sometimes what it does is kind of destabilize people and make them care less about their trauma situation. By the way, it should be apparent, but marijuana affects two different groups of people affected by marijuana. One group, when they smoke or eat or however they use marijuana, however they use cannabis, they forget about their problems. They can become relaxed. They become maybe even indifferent to what's going on around them. And then there's a whole other group that if marijuana enters their body, they become extremely focused to the point of paranoid. So you ought, if you've ever tried this plant, you know in your body which it is, because you don't want to suggest marijuana for somebody who's in a trauma mode that now you're going to enter paranoia into the realm of it. So it's just a consideration with cannabis. More trauma aids, California poppy. I find California poppy often in larger doses, best for people who get really angry in these situations. Something goes wrong and they start yelling at everybody. So their trauma mode. Hops. Hops is just a general relaxant, but probably once again for controlling aspects when things go wrong. St. John's wort, Hypericum. St. John's wort by itself or combined with other herbs works on all three, but I find it especially effective for people who get more into a depressive mode. Like that's famous, right? St. John's wort for depression, but also for when trauma affects them in a way where they don't want to interact with the outside world and they pull into themselves. So St. John's wort as a first aid plant for this more depressive character. But you can try with anybody. Most of these, except for the really strong ones, you can. Lavender essential oil, just the smell of lavender for some people will just kind of bring them to. Once again, as I talked about a little bit in the Materia Medica for seizures, sometimes the smell of lavender essential oil, or really any smell that's pleasant to the person, that has positive aspects to it, can break people out of their funk and make them more focused. Lobelia is just worth on all different. Lobelia, once again, is a destagnating herb. He's really useful for the depressive kind. For anything where the person kind of gets stuck in a pattern, whether it's a flighty pattern, an angry pattern, or a depressive pattern, lobelia can sometimes snap them out of it, a little bit like the essential oils can, but I think more dramatically. Lobelia is a primary anti-trauma herb for me. I would say anemone and lobelia are the two main herbs that I use when people enter a trauma mode, and I'm trying to break them out of the trauma mode. Chamomile, just very relaxing. Also, the smell and taste for many people is very grounding. They associate it with good times in their life. They associate it with relaxation. So just the smell itself, but definitely also drinking it. Tea or tincture. Chamomile tincture works great. It doesn't have to be tea. The tea, though, has all that kind of aromatic and memory stuff. Passion flower, which I mentioned briefly previously. Passion flower can also, I think passion flower is best for the angry type. So they hurt themselves and they just start saying, what a stupid thing that I've done. Shouldn't have hurt myself. I shouldn't have ever came here. That passion flower, just keep raising the dose. It can be really helpful as a trauma aid. Kava Kava, kind of in the inebriant mode of things for relaxing people. Skullcap and valerian keep showing up, and I've talked about both skullcap and valerian and Materia medica. They're really useful plants to have. And one more plant that acts a little bit, or two more plants, excuse me, that act a little bit like passion flower. So the first is blue vervain. Verbena hastata. I don't tend to use it in first aid because I find passion flower works a little better. But if blue vervain is a plant that's around you, you can also use it for the person who beats themselves up in trauma mode. And the last one is Tulsi basil, Ocimum tenuiflorum. There's many kinds of there's many kinds of basils, and previously Tulsi bagel, actually Tulsi bagel sounds delicious right now, but Tulsi basil, which sometimes is called holy basil or sacred basil, it used to be Ocimum sanctum, now it's Ocimum tenuiflorum. But actually in first aid, sometimes you need larger amounts. But that I find best for the person who becomes more flighty. So that when things go wrong, like I can't think, it's just, they become like windy and can't make any decision. It's not so much they're angry or stuck in something. It's just it feels like air currents running through their mind. And what you try to do is ground them. And Tulsi can be really useful for that. And then they should continue taking it because it can just be good, especially for people who get that way regularly. Tulsi is really helpful. So those are all, I'm sorry to go through these fast, but you'll get a sense of a bunch of plants that you can use during trauma. When things go wrong and people get weird and you're trying to help the weirdness, consider what kind of weirdness are they having and what plant works on that specific kind of weirdness. So I guess you can call them anti-weirdness medicines. So we're talking about aiding in restoration and recovery after some kind of traumatic event. So something that happens to them that's usually unexpected and just alters their psyche temporarily. For people that feel confused or anxious or stressful, and these are, if I put them in categories, like you could have hypnotic herbs or nervines, but really, I think here you try to find the specific herb that fits the person's kind of specific trauma mode. And so that concludes this little portion on pain remedies and with a bit on trauma, because first aid has a lot of trauma associated with it. I would really suggest experimenting with these they're so individual, and I can't always, I make these personality pictures up often, like this is good for this person, but you might try passion flower for a depressed person because you've heard it works there, and maybe it does work there, and so we just keep adding to what we already know about herbal medicine. It's just a constant compilation of watching people in real life and then learning from each other. So thanks.